Hello, welcome. I know that it's summertime. We've got small group today. We'll see if a couple other people are able to hop on, but of course we're recording our content and we're really excited to be here to talk about pregnant parenting and caregiving youth. Young students experiencing homelessness. So we have a couple of speakers today, and yeah, we're excited to do a deeper dive on this topic. We will go ahead and get started. Just real quick, I think most of folks have been in these sessions before, but just say hello in the chat box, share your name and pronouns, your district, your role, and a one-word description of how you are doing today. So I'm Amanda Wilson. I use she, her pronouns. I am from COHHIO. I'm the Youth Housing Initiative Director, and I'm excited. I think I'm feeling good. I had a slow start this morning with the gloomy weather, but so yeah, if you just want to take a moment to do that in the chat, we will, continue to move through the presentation, but you can definitely add that information in the chat and we can all say hi to each other. So our basic logistics, everyone can unmute. Like I said, we're a small, at least so far, we have some folks coming on, but we're a smaller group today. So just make sure you're muted when you're not speaking. And we invite you to share your camera if you're able to and you feel comfortable. Please ask questions anytime. I think I can safely speak for both of our presenters that they would be happy to have discussion and answer your questions. So you can always come off mute or put questions in the chat. We will send materials out. I'm kind of keeping track on the room, but we have enough people to do at least we'll do one or two breakout rooms depending on how many folks are here, so you have a chance to discuss and share information with your peers. No polls or quizzes today, no materials other than what's going out later. And as always, if you're having the AV issues, the best first step is to turn it off and turn it back on again. So if you need to log off and reconnect, feel free to do that. And also let us know if you're struggling with any audio or video issues. So our agenda today, welcome and introductions like always. Then we have Shana Bryant here from Healthy Beginnings at Home. So that's a really exciting program that she's going to tell you about. It's been implemented in a few cities, and it does a lot for folks experiencing homelessness who are pregnant and parenting. And then we have Nicole Eskridge to talk about Help Me Grow. Some of you may be familiar with Help Me Grow. It's a statewide program, but she's going to be able to talk about what that looks like in Southeast Ohio and how that works. We'll have time for Q&A throughout. We'll do our breakouts and then we'll close out like usual. So our objectives today are strategies, collaboration, and resources, really like what we focus on in this space. So yes, we're providing resources and information to you all, but we also want you to, of course, be thinking about any partnerships you already have for pregnant parenting and caregiving students, or partnerships you'd like to form, and thinking about those strategies to meet the needs of those students who are experiencing homelessness, and thinking not just about the student that might be a parent, but also their child who might also be school age, and is experiencing that situation, and how do we do the best we can for that family. Okay. And so, okay, I think we're gonna maybe stay in the big room since there's so few of us, so we can just have a group discussion. So does that sound okay to everyone? I'm seeing some nods and some thumbs up. Okay, great. So our team, I think we know everyone in the room. Again, I'm Amanda Wilson. We've got Ami Diallo and Evelyn Guerin, also on our team doing this work for you. And we can go to the, yep, and then I already mentioned Shayna and Nicole. So I'm excited for them to share their content. And I think, do we have any other introductory content? Are we ready to
That's it. We can pass
turn it over to Shayna? Thank you.
All right, where are we? Morning, afternoon. Good afternoon, everyone. Thank you for joining. Thank you for having me. I am going to attempt to share my screen. All right, can everyone see that?
Yep.
Awesome.
Yep.
Awesome. Okay, and I must give full disclosure, I am terrible with slides, so they may possibly jump around. I apologize in advance. As Amanda stated, I am Shayna Bryant with COHHIO. I am the Healthy Beginnings at Home project manager. So as far as Healthy Beginnings at Home, the problem was identified that safe, stable, and quality housing is essential for families to thrive and achieve optimal health. We know that housing instability and homelessness increases the likelihood of preterm birth, infant mortality, and acute health conditions. Despite its importance, a lack of affordable housing in Ohio and nationwide has made families, particularly families of color, vulnerable to homelessness and other forms of housing instability. So the solution that everyone involved came up with, in the past, we had a pilot of Healthy Beginnings at Home in 2018. And Healthy Beginnings at Home is a community initiative striving to improve birth outcomes and reduce infant mortality through an affordable housing intervention. So the intervention with this project is providing affordable housing for our pregnant women and their families. Presently, phase 1 research results were very promising. So from the pilot in 2018, the results were very promising. In 2018, it was a very, very small group, but because of the great results, we have planned for a statewide replication with rigorous evaluation. So much larger group, much larger scale, which is underway right now. So we have 2 communities right now who are implementing Summit County and Franklin County. As far as the future, the findings from this research will be used to support public policy improvements around infant and maternal health and drive resource decisions at all levels, so federal, state, and local, as well as managed care organizations. So, excuse me, health outcomes for the initial 1.0, we call it, we have their levels to all of them. So 1.0 is what we refer to as the pilot. 40 of 51 babies in the intervention group were born full term and healthy birth weight in comparison to 24 of 44 babies in the usual care group. So that is phenomenal results. 4 fetal deaths in the usual care group and no deaths in the housing intervention group. And then it was a much decreased stay in the NICU for the intervention group versus the usual care group. Cost savings is Medicaid spending As you can see here, for the blue represents data for infants only. And so you can see the significant difference as far as Medicaid spending for the intervention group versus the control group. The green represents the entire family. And again, the intervention group Medicaid spending was decreased significantly than the control group. Any questions so far? I can't see everyone. No. All
No.
right. Okay. Yes. So we're going to move on to the structure of the program. So COHHIO is the implementation lead. And then we work with the entity that evaluates the research outcomes is Health Institutes of Ohio. So you saw the acronym, so this is testing me to remember who everyone is. And we also work with Nationwide Children's Hospital. Right now, like I said, we are working with Akron, which is Summit County, and Columbus, which is Franklin County. They are actively implementing Healthy Beginnings at Home right now. So their partners are Summit County Public Health and United Way of Summit and Medina. And then Columbus partners are Celebrate One, who is a huge proponent of infant mortality. I think that's essentially what they do. HFF and CMHA. As we expand the project, we'll be bringing on Cincinnati and Dayton. They are in the process right now of bringing on partners that are a good fit for implementation. And then we have funding from ODH, state budget, which we're in a holding pattern with the state budget right now. Unfortunately, what we were promised has been cut, but there's some negotiations, I guess that's probably not the right word, but we are begging and pleading and advocating for the funds to be restored so that we can continue with the expansion. And then we have some philanthropic and other fund development. As I mentioned, so our current cohort is Akron, Summit County, and Columbus. Right now, we have Akron slated for 30 households and Columbus slated for 60. We have not reached either of those as of yet. Affordable housing is a huge barrier for us right now. And so we're trying. As we run into barriers, we are trying to find ways as far as working with landlords and other incentives that can assist us in finding affordable housing in safe neighborhoods where our families want to live. So, and again, bringing on with the expansion, Cincinnati and Dayton. So the project overview, the way that the study is designed, enrolled participants must be pregnant adults in their first or second trimester, adult meaning anyone 18 or over. Even if, we have some young adults who are 17 that will be turning 18 within their first or second trimester. So we can still work with those individuals living in Franklin or Summit County with a household income at or below 30% of AMI. They must be enrolled in a managed care plan and experiencing housing instability or homelessness. A lot of people have asked what's the difference or the variation between housing instability or homelessness. So it's literal homelessness or families and individuals that are just sleeping where they can, like couch surfing or relatives, friends. So that's instability. And then the housing intervention, rental subsidies, time limited or ongoing, and housing stabilization services, which you'll hear us refer to as HSS. So as far as the rental assistance and how it is structured for this model, the participants receive 15 months of rental subsidy, covering the gap between full market rent and 30% of the participants' income. After that, that is followed by a 9-month step down period in which the subsidy decreases gradually until the participant is in a position to pay full rent. And some participants may receive a HUD housing choice voucher or find housing in units that include a full rent subsidy on an ongoing basis rather than the time limited. So if we get to a point where as far as employment and other resources, if they aren't meeting the need for the family to have the ability to pay full rent, they can receive or apply for a housing choice voucher. And then the housing stabilization services. So this is I guess equivalent to like a case manager, but we call them HSS, and they help participants identify housing, negotiate with their landlords, and remain securely housed when faced with challenges. So these individuals are amazing. They are available to our participants like 24/7 via text, phone. They're fully accessible, and if anything arises, they are there to jump in to avoid another, a possible eviction or another housing instability situation. And within the HSS services, we go by the model of family critical time intervention, housing first approach, clinical best practices, including person-centered planning, motivational interviewing, and trauma-informed care. Other usual care supportive services include access to maternal home visiting. They're linked with educational services, employment assistance, resume, anything that we can think of to stabilize the families and put them in a better position. This slide really just encompasses everything that we need to be successful with this model. All aspects, which include, of course, the mom, the baby, whatever supports the mother and the family has, helping with child development, housing, maternal health. That's it. Okay, so moving on to evaluation and research. Again, Health Policy Institute of Ohio is our research lead. We have a research advisory committee that just assists with all of the data collection and analysis, which is composed of Nationwide Children's Hospital, state agencies, including ODH and ODM, HBH 1.0 participants, which in this iteration, we refer to the prior participants as community advisors, which is really amazing because they are individuals with lived experience. So they are able to provide us with feedback. They assist with development of forums and other meetings because they have that actual lived experience. And that's what we want for equity purposes, and to make sure that we are providing the best service that we can. And then we have national experts. We have COHHIO's HMIS team, which Amanda used to be, right? And HMIS consultants. So our key matrix for the current project is improve housing stability and reduction in homelessness for our HBH families, improve birth outcomes and family health outcomes through 3 years after birth, reduction in Medicaid spending, both for the birth and household while receiving assistance and during the first 2-year follow-up period, as well as reduction in racial disparities. The analysis is composed of both quantitative and qualitative analysis. So I won't read through all of these, but and then I love, we have a quote from one of our participants who said, "Housing is the key. I kept trying and failing to save, but they gave you they gave you this opportunity to start fresh. That was a blessing." So that is the sentiments of a lot of the participants that we are working with. We also, with the approval of the IRB, the Institutional Review Board, have been able to hold a couple of sessions with our participants where they provide project improvement. So this is an all-inclusive project. Okay. So this is my information and our managing director Douglas's information if anyone wants to follow up with us. Do we have any questions, any feedback?
So I have a question. So with the in the information that you gave, you said that they offered like home visiting services and stuff like that. But I guess my question is, if I have a family that says that needs like housing or help with housing, will we offer them home visiting? Would they be able to do both, or would they have to pick and choose like who they would end up working with? Since you go through ODH as well, is that what you said?
Yes. No, that's a great question. No, we work in collaboration. So if they're already linked with home visiting, that's sufficient. Like it's not one or the other. I mean, we want everything, every service that we can that the family is willing to accept. So yes. Thank you. Okay, we don't have any other questions. I will kick it over to Ms. Nicole.
Let me share my screen and get myself together here. 1 second here. It's like trying to get there. So let me get my little slideshow up here, maybe, if it lets me. It may not let me, but it's okay. So I am Nicole Eskridge. I am with Integrated Services for Behavioral Health under the umbrella of Help Me Grow. I am a family support specialist, but also like lead supervisor. So who we go through, I'm a supervisor in their eyes, but within Integrated, I'm a lead for them. So I had to have 2 titles under my belt essentially, but it basically does the same thing as well. So what I'm going to be basically talking about, what I'm trying to like, there we go. What I'm basically going to be talking about is what is Help Me Grow, what's our target population, and then the resources that we offer. So basically, Help Me Grow is a home visiting, Help Me Grow Home Visiting is a voluntary family support program for pregnant women or families that are new parents, have a new baby, or are caring for new children. Help Me Grow is evidence-based program that promotes healthy growth and development for babies and young children. We have we're under the module of health with HFA, Healthy Families America. So that is who we kind of go through. This is kind of what we kind of follow their standards, their best standard practices as well. Along with that, so we kind of have curriculum that we use and kind of what we follow and everything like that as well. Sorry. So our home visitors are well-trained professionals who use non-judgmental and compassionate approach that empowers parents with skills, tools, and confidence to nurture a healthy growth of their children. So when we say families, we're talking, we've had where there's grandma, aunties, cousins that are caring for, a newer baby as well. So we kind of just take on all dynamics of family, and we kind of use it in a uniform. We use it in a uniform term.
Thank you for doing that.
So next is the target population. So basically, our target populations are family who are enrolled. We typically try to get families that are enrolled prenatally or within the first 3 months of the child's birth. We still take them even if the child is, 4 months or older. The only thing is what they will fall under what we call an alternative population. So we can only each family support specialists, we all have a certain amount of percentages of our caseload to be able to be for kiddos that are 4 months and older. But that's why it's kind of like crucial for us to try to get them 3 months and younger as well. But it just really depends on what we have available on our caseload. So with that said, because of that, we have noticed the growth and the need for additional, home visiting services as well in all of Ohio. So we're actually in 8 different counties in Ohio. So I've got my list, so I'm gonna look down real fast. So we are in Licking, Franklin, Pickaway, Meigs, Gallia, Athens, now and going to be in Fairfield, and Jackson as well. So I am the lead over Franklin County, Pickaway, and the soon to be Fairfield as well. So I am located in the Franklin County office, but we serve all those other different locations as well. And we have family support specialists down there as well. So once we offer services, and once they're enrolled, we contact the family, say, hey, you're put onto our caseload. We got a referral from Medicaid. We got a referral from the hospital. We got a referral from your grandma who referred you. And we make it a point to make sure that the families are aware that this program is 100% voluntary, because sometimes we run into where CPS or try to put it part of their safety plan. And we kind of have to come in and say, oh, sorry, it's not really like mandatory. I know they try to put on your safety plan, but it's 100% voluntary. So in the past, we had it where we can offer services up until the child's 3rd birthday. But just recently, as of July or August of last year, I want to say August of last year, we got the okay and got the green light to continue to offer services to families until the child's 4th birthday. But we're only allowed to do that if the family opts out of sending their child to like an early Head Start or preschool or something like that. That's typically when we can continue on with the families until the child's 4th birthday as well. But any questions so far before I continue to keep going on? No?
Hey,
Okay.
so
Okay.
you were talking about the people who reach out to you. Do school usually reach out to you or not?
We do have some schools that would reach out to us. So a part of Integrated, we just opened up a program where we actually have some community behavioral health workers that are actually going into the schools. And so recently, since we kind of created that program, I don't know the exact number, like the exact name, just because it's so fresh, new. I have to kind of ask about it. But we it's kind of like a school where for troubled youth, and a lot of the youth that are there are youth that kind of was like their second chance, third chance type of school system. So a lot of them are teens, like pregnant teens as well. So recently I've been getting a lot of referrals through our new program with Integrated, where we kind of are teamed up with school districts. And we actually just opened up another program as well in Southern Ohio as well. I don't know the exact acronym for it, but once I know, I can always, email, and then we can always send it out as well. But some of the resources do come from a school, because I know some of the people that I have on my caseload, they've came from their middle school and been a middle school teacher or something like that, or a high school teacher that kind of referred them and kind of said, hey, or a guidance counselor, hey, I really think this would be good for you. I just, to have these services to kind of teach you the ins and outs of, parenting and being able to parent, because sometimes they're young and so they may not know themselves of, how to help themselves as well, let alone be able to help, their child as well. So, but yeah, we do have some of our resources do come from school, but majority of them we see them come from doctors' offices, like Medicaid, WIC, and stuff like that as well.
Thank you.
You're welcome. So Help Me Grow is designed for parents facing challenges such as single parenthood, low income, childhood history of abuse, and other adverse childhood experiences, and current previous issues related to substance abuse, mental health issues, homelessness, and or domestic violence as well. So a lot of the resources that we do offer is when a parent schedules a home visit with Help Me Grow, they will have the opportunity to share their thoughts about parenting, ask questions, and receive reliable information based on their individual family needs or topics or of interest. So some of the topics and what we kind of go over is like healthy pregnancy, baby and child health, breastfeeding, nutrition, immunizations, child growth and development, discipline, toilet training, child safety, household safety, and local resources as well. So with us being under the umbrella of integrated, whenever I have a family that is in need of mental health, behavioral health, or something like that, it's really beneficial to a lot of our families to be able to resource inside agency, because then it's less of the family having to repeat themselves. It's more people being able to know what their plan, what their treatment plan is, and everything like that as well. So I like the aspect of us kind of falling under within integrated as well. And then with integrated, they do have some housing. A lot of our housing goes towards like incarcerations or recent release of incarceration and stuff like that. But I know there's been times where we had pregnant teen that got released from jail, so we were able to get her into housing because she fell underneath that recent incarceration, and drug addiction and everything else. So we kind of got to get her housing through that. And I know they're trying to look how to revamp our housing as well. So we kind of have a lot of moving parts going on within integrated as well, as far as housing, because we do own housing, and we do own some residential facilities as well in Southern Ohio as well. So we're definitely growing within integrated agency as well. So additional information. So weekly visits are also completed like prenatally into the child's birth. This will give the family the time and the chance to get connected with resources that they will need to prepare for the arrival of their new baby. We have staff that are like safe sleep ambassadors, crib distributors, which goes into the infant mortality rate and everything like that. So we have all of our staff, especially here in Franklin County, go through the safe sleep training as well. So that way we can get all of that going. So then we can kind of give them a full circle of resources as well. The staff can then provide the family with safe sleep options via pack and play at no cost to them. We can also offer mental behavioral health counseling, case management to the families that we serve. Which I kind of said that, which is the benefit of, kind of having everybody under one roof is being able to have the ISBH kind of come in and kind of take over in that sense. So basically, with a lot of our families that we serve, if they do end up becoming like homeless or needing help, like help with housing as well, so say they separated from their significant other or whatever like that, we can always get them connected with some of the resources. But like some of the things that we are running into is just trying to, like, as has been stated before, is just trying to find the landlords that are willing to rent the low income, but then still in a safe area where if they want to take their kiddo outside, they can take their kiddo outside to be able to play with chalk and not have to be fearful of, what might be, lurking in the neighborhood as well. So I'm trying to think, was there anything that I didn't answer that you guys might have questions about, or did anything come up as well? Okay. I'm trying to think if I like missed anything, because that's kind of like the end of my slides. But I was trying to think, like, make sure I like answered all of the questions and kind of like all the pinpoints of what needed to be answered as far as that goes as well. But I'm gonna stop sharing my screen and then we can go on.
Thank you so much to both of our presenters. That was really interesting information. And it's great to know what's out there in different areas for folks. And so I think that we're just going to move into our discussion questions as a group, because that's what we agreed on at the beginning. I'm not, Evelyn, do you have the slides up? I know I have some questions, but like, so in this kind of like takeaway, and we can put these in the chat so that we can stop, share, and look at each other's faces. But like, I guess what I'm interested in is what existing partnerships you have and what ones you're interested in as far as resources for pregnant parenting and caregiving youth. And you know, when you hear about these programs, what do you think about in terms of like trying to make those partnerships, or what could be troublesome and difficult to implement in your communities? So questions as well as the positives in your community. I think that it's helpful to hear both. You know, we don't you know, we want to know what's going great, but we also want to know where the challenges are, and figure out how we can best support you and how you all can support each other in this space. So is there anything else we needed to cover, team, to close? We've got about 5 minutes. No. Okay, we're off.
No,
What'd you say?
we just had additional strategies, but like with the conversation, I think we've talked about all of that already. And this is like a group who already knows what they're doing. So yeah.
Okay. Well, our next session will be in August, and I am working with Ohio Domestic Violence Network to have a speaker come and share about issues of intimate partner and family violence and how that pertains to our youth experiencing homelessness. If any of you are familiar with ODVN, they're a fabulous organization. So I just reached out to them today and they're getting it coordinated. So I'm hopeful that they will be able to confirm, and we'll be able to explore that with them, because they always provide really great content. So we'll be in touch. As always, we welcome your feedback. Please don't hesitate to reach out with anything you need, any questions, and I hope everyone has a great summer. I know we'll be talking to you, but it's like, oh my gosh, we'll be back in August, and yes, it'll be here before we know it. So try to enjoy it.
Thank you so much. We appreciate
Thank
you.
you, everyone.
Bye-bye.
Thanks,
Thank you.
everybody.
Thank
Bye.
you.